Mayor Limpert.
Here. And we'll start tonight's meeting with announcements. And I'd like to ask Council President Cohen if you have any announcements this evening.
Yeah, just a real quick announcement. We have a meeting of the Permit Parking Task Force, which we are looking to set up for January 12th. That's Tuesday evening in the Witherspoon-Jackson neighborhood. We've already had one meeting in that neighborhood, but the thinking on the permit parking plan has evolved so much that we want to do an encore neighborhood meeting. So that's my one announcement.
Great, thank you. And Councilwoman Fraga?
No announcements, Mayor. Thank you.
Okay, thanks. Councilman Williams? No.
My space bar wasn't working for taking the mute off, but none for me, Mayor.
None for me either.
For me either.
Okay.
No
Right.
announcement.
And Councilman Niedergang, any announcements? No, and no, and any Councilman Sachs?
Nothing tonight, thank you.
Oops. Okay. I'm not sure if that was on my end or someone else's end, but I had like a slight hiccup.
You were frozen for a couple of seconds.
Okay, well, anyway, glad to be back. I had a few announcements I just wanted to go over. The first is on this Wednesday at 1 p.m. There will be a virtual town hall led by the chair of our Board of Health, Dr. George DeFernando, and it will be all about vaccines. So if people are interested, it's being sponsored by the Princeton Senior Resource Center. It's free, but you need to register ahead of time. So you can find information on that on the Princeton Senior Resource Center webpage. And I believe also on the town website. And that's my second announcement. It's that the town has a brand new, beautiful website that we're really proud of, and hopefully it's a lot easier for folks to navigate. So we encourage people to explore and understand we're still adding information, especially over the next several weeks. And we welcome your feedback and constructive suggestions on it. Also, I will be holding my last Meet the Mayor session this Friday at 8:30 a.m. It'll be virtual, and the link for that is on the website. And just wanted to go over the remaining meetings of the year. So obviously we're meeting tonight. We're going to be meeting next Monday night, December 21st. We're going to be having a special meeting on the 22nd to honor a lot of our community partners and volunteers. We're so lucky to live in a community where so many people have stepped up, especially this year. And so we wanted to take a night to thank everybody for doing that. And then we're also going to have our final meeting of the year on December 30th. And then reorg is scheduled for January 5th. And I see Ms. Stockton and wanted to see if there are any engineering announcements tonight.
Yes, Mayor, thank you. I just wanted to announce that tomorrow, Tuesday, our contractor will be doing emergency paving work on Spruce Street, Maple Street, Linden Lane, and that's all of it. But this is work in advance of the winter just to button up the roadway and to make it safer for the pedestrians and drivers in that area.
Great, thank you. Ms. Niedergang?
I have to correct both you and myself because I gave wrong information at the last meeting. The reorg is Monday, January 4th. I apologize for feeding you incorrect information that you then repeated. Sorry about that.
Thank you. And are there any other staff announcements? Okay, then we'll move on to our presentations this evening, and we have 3 sets of presentations. The first one, I would like to welcome Carol Golden, who is the Executive Director of the Housing Initiatives of Princeton, and also Judge Phil Karchman. So as many people in the community were aware of, Princeton had partnered with the Princeton Children's Fund at the very beginning of the pandemic back in the spring to offer rental assistance to people who needed it. The funding for that came largely through funding from Princeton University, which we're very thankful for, and also community donations, but the money in that fund ran out. So now we're looking for round 2 of rental assistance, and there's a resolution we'll be voting on shortly to partner with the Housing Initiatives of Princeton to manage that funding for us. And the money for this round is coming from the community development-based grant that council's heard presentations on in the past. This is federal funding. So I want to turn it over to Carol and to Judge Karchman to explain their thinking about how this phase 2 would work a little differently than the phase 1. And I'm really excited for them to share the work they've been doing on a mediation process, which should help to spread the funding that we have over more households ideally. So with that, I'd like to turn it over to you, Carol.
Thank you, Mayor. I'll start us off and then I'll hand it over to Judge Karchman. Thanks for having us here tonight. I think the mayor outlined actually a lot of what I was going to say in terms of the need. I wanted to start with describing the need, which many of you are familiar with back starting in the spring when the pandemic hit, and that the Princeton Children's Fund stepped up and did provide quite a lot of money in rental assistance for those who were unable to pay their rent back then. That money was done by mid-August. We've been, Housing Initiatives of Princeton has a history of doing rental assistance. So we were, a logical place to go to try to pick up the baton. Unfortunately, we didn't have that many dollars to provide that we are now able to with this community development block grant that the town is going to be able to use for rental assistance. So we did stumble along in September, October, November, and we did provide a fair amount of rental assistance actually to members of our community as well as people in the surrounding towns who are struggling. But as winter hits, and whatever work there might have been for those few months, as we all know, is going to be hard to find. And it's going to be hard for people to make ends meet. And their biggest expense is their rent. So with this CDBG funding, we will be able to provide 3 months of rental assistance, consecutive months, either going forward or actually in arrears. So some folks who are still behind in rent may need to get caught up. And we can go for 3 months in advance. As I said, HIP has done rental assistance for about 7 years, but not at this scale. So we beefed up our rental assistance committee, which is all volunteers. We've actually more than doubled it over these months. We've been gearing up for this. We have 7 bilingual Spanish-speaking members of the committee so that they will be able to communicate with those who don't speak English as their first language. And we're excited to be able to step up here with these funds and keep people safe in their homes. You know that there's an eviction moratorium. We know that that's very helpful, but eventually that is going to be lifted. And the goal is for people to not be in such a deep hole at that time when the eviction moratorium is lifted that there's no way they can ever catch up. And one of the things that we came up with as a way to stretch the dollars more than was able to be done in the first phase was with Judge Karchman and a few other retired jurists and lawyers and participants of the community to develop a mediation program to bring landlords and tenants together to try to help spread the money as widely as we can so that tenants are safe, landlords are not without any funds, but perhaps there's a compromise. And I'd like to turn it over to my esteemed colleague, Judge Karchman, who will help you understand the mediation piece of this.
Thank you, Carol, and thank you all for hearing us out this evening. Carol put together a committee of one of my former colleagues, the former Chief Justice Deborah Poritz, together with some lawyers and others, to try and develop a mediation program as a methodology for allowing landlords and tenants to resolve the issue of outstanding rent in an appropriate forum. And the objective is to reach an accord for a 3-month period and allow the landlord to be satisfied as to the rent being received, and to give the tenants the wherewithal to remain on their premises and not be burdened with the issue of outstanding rent, at least for this period of time. So we developed what is a relatively simple and straightforward mediation program. And just to give you a sense of who the players are and the parties, each mediation will involve a landlord and a landlord representative, be the landlord's attorney or someone in the landlord's organization. The tenant will be there with counsel, and on our committee we have a tenants advocate who apparently has the ability to gather together a cadre of folks who will represent the interests of and advocate for the tenants. There will be an interpreter, since many of the tenants will require interpreters to assist. There will be a tech person from Carol's organization who will actually run, these are all virtual mediations, who will run the mediation program from the technical side. And then last but not least will be a mediator. And the question is, where are we going to get all of the personnel to staff this? And we've communicated with the Mercer County Bar Association, and they have enthusiastically agreed to send out a letter to members of the Bar Association seeking volunteers to serve as mediators and as counsel. They gave us a good feedback that they thought we would get a response. And what we did a week or so ago is we ran a test mediation, if you will, a pilot of this pilot. And we had a landlord there, we had a tenant, we had a volunteer attorney, we had an interpreter. I actually sat as the mediator, and I was able to maneuver the Zoom screen to make it work. And we were very pleased to find that we had a successful mediation. And both the landlord and the tenant agreed on a rent to cover the 3-month period. So our first experience was very positive. We see this as a program that can work, that we will have, we are hoping we will have the volunteers necessary to make it work. What is critically important is that this program is being run before tenancy actions are filed in court, so that, you know, we don't have the issue of eviction hanging over someone, or an order of eviction, which is presently stayed. But as I say, this will be pre-filing. So none of these cases are in the tenancy court at the present time. And I will tell you that I spoke to the judge, a former colleague of mine in Trenton, who handles the landlord-tenant calendar, and no one is more enthusiastic about this program than he is, because he sees this as a way of even in small numbers, reducing his calendar to some extent. So that's the nature of the program. It's not terribly complex, And it's not different from mediation programs that you will find in other circumstances and situations. What is also important is that the issue is very narrow. It's a question of rent. And hopefully that will allow the program to run smoothly and be operated in a timely manner. We can allocate a certain amount of time and hopefully resolve the issues within that period of time. So any questions anyone has?
Mayor, can I just say one thing that I just want to underscore what Judge Karchman said about the pre-filing aspect of this, because with my other hat of HIP's other mission, which is the transitional housing piece that we, help 5, now 6 families stay in Princeton for up to 2 years. We are in the middle of selecting the next family, and what we're hearing again, is just the confirmation of what I've known. People who have an eviction on their record, even just the filing on their record, puts them at such a huge. It's just an albatross they cannot get rid of, and it makes it so much harder to move forward and get their lives in order. So if we can do this before the filing, it's just a different way of approaching these kind of cases.
All right. Councilwoman Niedergang.
Thank you very much for what you're doing. And I know, Judge Karchman, you said this isn't really that creative a solution, or maybe I'm putting words in your mouth, but in my mind, this strikes me as a really just absolute thinking outside the box, utilizing the resources we have in this community. So thank you, Ms. Golden, Judge Karchman, for your leadership on this. It warms my heart to hear this, and I'm so glad that we're partnering with you on this. I just do have one question. Is there any, it seems like the individual mediations are very, at least if you describe it, could be very one-on-one, but is there any interest in kind of establishing, like, to suggest to landlords, most landlords are taking 70% of most landlords are taking 75%, to kind of develop a formula almost that you ask people to accept as, sort of the majority of their peers are doing? Or do you see this absolutely as each mediation is going to be sui generis and just, in and of itself?
Carol, do you want to answer, or I'll answer?
Well, I'd like to hear your answer.
Okay. I think we take each individual case as it comes. In some instances, and we found this in the first mediation that we conducted, the tenant had some wherewithal to contribute to the rent. So using a hypothetical 70% formula or whatever wasn't necessary in that particular instance. And there are going to be other instances where the nature of the parties and what's involved may require something higher than 70 or 75%. But I think there's a reality which Carol and I have discussed, and I think you're all familiar with. Word's going to get around fairly quickly in the community, and folks will understand what the process is, hopefully look forward to the process. And at the end of the day, the optimal situation would be that landlords and tenants talk to each other without the necessity of our intervention and resolve this. But at this stage, I think we're a bit reluctant to establish a benchmark number, which wouldn't apply in one instance or another. Carol, anything?
I agree.
Ms. Fraga?
Yes, first I want to echo what Councilwoman Niedergang said, thanking you for, this is definitely going to be a most welcome program, and anybody listening today that's going to relay it to our community, better believe that the word's going to get around. But I know we're all looking forward to seeing what the criteria is going to be, because I think we all recognize there's going to be more demand than what there is funding for. And I'm, I know you've been doing this for a while, and also probably familiar with when SURF was in place. But, and probably learned a lot from that process. But I was wondering, and perhaps, I don't know if this is part of it is a question for Mr. DeShield, but one question was, if someone's not going through mediation, are they still eligible for rental assistance? If they agree on their own with their landlord to perhaps a reduced rent, rental payment, do they need to go through mediation in order to access the funding? That's the first one question.
No, they don't have to go through mediation because technically, in order to qualify for the funding that the town is going to get from the HUD, what is required is a lease, a signed current lease, and a self-certification of your income, family size and income, and where you fall. We are strongly encouraging everyone to attend mediations. But as Judge Karchman said, if they can make a deal outside of a mediation, that doesn't mean that we won't fund it.
Okay.
I think communication is going to be, really key. We are in the community now. We have been for a long time, but since the pandemic, really making more efforts to have people in the community who know what we're doing, know they can get help, and sort of be able to communicate with tenants and landlords of what's going on. A letter went out to all the landlords under the mayor's signature to tell them about the funds coming. There's going to be another letter going out very soon. We're waiting for this meeting about the mediation piece and encouraging all landlords to participate.
Okay.
Judge, anything else?
So my other question, and in part because this is HUD funding, I was wondering if households who have mixed status families would still be eligible for this assistance.
Yes.
Okay.
The main criteria that we do want to get the word out about is that your name has to appear on the lease.
Yes.
And so that was the letter that went out earlier to encourage landlords to meet with their tenants who might qualify for this and make sure that their names appear on the lease so that they will be eligible.
Right. And because I understand that in many of these households, the leaseholder perhaps is the one who's responsible for the rent, but very often if they're subletting in some informal way, collecting the rent, that it should still be, the process somehow it's assisting whoever's living in that household, but the person who's on the lease is the one that's responsible, correct?
Correct.
And my last question, I didn't see it anywhere, but perhaps it doesn't apply, but because this is city BG funds and most likely there's going to be, we don't know how long this need is going to be in place, whether there's going to be the opportunity or the means to be able to add to solicit additional funding for it. I'm not sure who can answer it.
I'm going to try to answer it from my understanding. In terms on an annual, we do have a 5-year plan for it. So this could be a recurring expense. I'm just not sure the details of how much more would be available.
Okay, thank you. That's it.
Thanks. Mr. Cohen?
I just want to make a comment more than a question, although there is an associated question. I do think that it makes a lot of sense to strongly encourage the tenants to do the mediation process because of the power asymmetry between a landlord and a tenant. I think it'll be a rare tenant who will have the savvy and the legal knowledge to be able to negotiate successfully the lowest possible agreement with the landlord. And so both for the tenant's sake, but also for the sake of stretching the money, it seems like you would want to go through that mediation process. The question is whether tenants can get legal assistance outside of the mediation process. If, for instance, there's a landlord who's really eager to, avoid mediation and do it quickly and simply, could a tenant access the volunteer legal services that you're talking about having available for an outside of mediation negotiation?
Well, the Volunteer Lawyers for Justice is the organization that we're working with to get the volunteers to to help in the mediations and advocate for the tenants in that context. They're also available, to help landlord-tenant issues all the time. And HIP refers any cases that we get that are for rent assistance, but who have issues that, are a tenant go up, that a lawyer should be looking at this. We send them there or to Central Jersey Legal Services, and they're very responsive, both groups.
Thank you.
Are there any more questions for Carol or the judge? Okay, I just want to echo my thanks for to both of you and to HIP for stepping in. I know this is it's a big program to run, and for everybody that you make happy, they're like Councilwoman Fraga said earlier, the need is so great, and we would hope, but I don't think we should expect that this is going to be enough money to satisfy all of the need. So, want to thank both of you for stepping up and for trying to figure out a fair solution to try to stretch the money in a way to help the most people. So we look forward to working with you. And I wanted to see if there was a motion to approve 2383 resolution authorizing execution of agreement with Housing Initiatives of Princeton, HIP, in connection with Community Development Block Grant, CDBG. It's been moved by Ms. Fraga, seconded by Ms. Perrin-Lambros. All in favor?
Aye.
Any opposed? All right, the resolution passes unanimously. Thank you so much.
Thank you, Judge.
Mayor,
Thank you.
can I just say thank Mayor Lempert for her leadership on this. I really probably could not have gotten this done without her, and she really was in the weeds with me for a while and really helping figure this out. And of course Judge Karchman and Judge Ports. But Mayor, you really made this happen, so I really appreciate it.
Okay, we'll right back at you. So thank you.
I second that motion as well.
Thank you. Thank you very much. No, it's been a pleasure working with you, and I look forward to seeing this project and initiative really come to life too. So
Thank you.
okay.
Take care.
Thanks. Have a good night. You're welcome to stick around, but you don't have to either.
Thank you.
Okay, good night. Okay, our next presentation is with Princeton University on their reopening plans. And as many of you have probably heard by now, the university has welcomed back its undergraduate students for the spring semester. And this is, given that where the pandemic is right now, this is a huge undertaking that I know the university is taking seriously, and also our health department and everybody on the municipal side is also taking extremely seriously. And it's a lot of work to make sure that students are brought back in a way that's safe for them, safe for the university community, and safe for the Princeton community as a whole. A huge component of making sure this is going to work is good communication. And that is part of the basis of having the university officials come and speak with the council tonight. And they've also been having conversations with Jeff Grosser on a regular basis as the pandemic has progressed, and about what the latest guidance is from the state and from the CDC. So I do want to thank Treppy Williams, who I see at the bottom of the screen now, for joining us tonight, along with the rest of the Princeton University team, and wanted to hand it over to Treppy. And Jeff Grosser is here also, our health officer. But Treppy, did you want to introduce everybody from the Princeton University side?
Yes, that's terrific. Thank you so much, Mayor. Good evening. So as Liz said, I'm Treppy Williams. I serve as Princeton's Executive Vice President, which is essentially the university's COO position. Among the areas reporting to my office are campus life and environmental health and safety. So with us tonight, we have Rochelle Calhoun, who's the Vice President for Campus Life. And we have Robin Izzo, who's the Executive Director of Environmental Health and Safety and serves as the university's incident commander for the institution's COVID-19 response. And of course, we have Tenants Advocate, with whom you're familiar, or Director of Communications and Regional Affairs. So as the mayor said, communication is so important. We really appreciate the opportunity to be with you this evening as we all continue to confront the challenge of COVID-19 and to protect our communities. And let me also thank Jeff Grosser for his guidance as we've implemented protocols for our campus operations this past fall semester, and as we plan for the spring semester and the return of more undergraduates to the university's campus. So my colleagues and I are happy to answer questions about the university's plans for the spring. Before we do, I want to provide some context and an overview for these plans. So as background, over the fall, we've had all our graduate students back on campus, as well as about 200 undergraduates who were international students or students with housing precarity. This past fall, graduate students had some in-person instruction. The undergraduate education was completely online. We resumed our research operations. We opened the university library, and we supported our students and residents in accordance with the public health guidance. In addition, we employed a testing protocol, so PCR testing for all undergrads twice a week and once a week for graduate students and faculty staff who were spending more than 8 hours a week on campus. We've traced the contacts where there were positive cases. We imposed isolation and quarantine protocols when appropriate. We de-densified the campus, so those faculty and staff whose jobs could be done remotely have worked from home. And over the course of the fall, we've learned more about COVID-19. We've learned from our campus experience, that is from the graduate students and undergrads on campus, as well as our resumption of research. We've closely monitored and learned from other colleges and universities that have brought students back for the fall semester. And we have built and opened a testing lab on campus for the campus community, which will enable a faster turnaround for tests. Let me just pause here because there have been a number of questions about whether we could expand and use the campus lab for folks who are beyond the university community. We were able to get a license, but the license that we have is limited to the university community. So we are not able, consistent with our license, to expand that testing to other populations. So, with this increased knowledge about COVID-19, with our campus experience, and we've had a good compliance with our testing protocols, masking, and other public health guidance and policies, our learning from other campuses, and our own testing lab, which is now in place. With all of that, we've decided to invite all enrolled students back to campus for the spring semester, which runs from February 1st until the end of May. So what does this mean exactly? Usually we have 5,300 undergraduates. This year we have 4,600 who are enrolled. And of that number, about 3,400 have indicated they wish to return to campus. So we will remain de-densified, certainly, from how we usually operate. What this enables, and what is what we wanted to follow, was a 1 student per sleeping space protocol. We also have reserved dorms exclusively for isolation space, should we need that. And students will start to arrive on January 15th in a phased move-in by reservation multi-day period, so that we can they can complete quarantine prior to the commencement of the semester on February 1st. All students, no matter where they're coming from, so if they're coming from across town and they arrive on campus, will be tested on arrival, and then, consistent with the CDC and state guidance, they will either isolate if they have a positive test or quarantine for 10 days. They may have a shortened quarantine period for 7 days if they get a negative test on day 5 or later. So thereafter, we'll have the same testing protocol we had for undergraduates in the fall, which is testing twice a week. The returning students will have to sign a social contract in which they agree to the testing and a host of other restrictions, travel restrictions, gatherings restrictions, understanding their responsibility to wear face coverings, no guests permitted in dorms, to name a few. We are making it really clear to students that coming back to campus is only for those who can accept these responsibilities and understand that they would be faced with disciplinary consequences for not carrying out those responsibilities. Our plans and policies are all aimed at establishing a culture of community care. So, as was the case in the fall, we understand that there will be undergraduates who live in the local community. We don't know how many yet or where, but we should have those numbers by early January. However, those who live in Mercer County and Plainsboro will also be part of the testing program, will sign the social contract, and will be subject to all the same restrictions I just described that are relevant to the students who are living on campus. As I said earlier, the restrictive environment will not be attractive to all students. We are enforcing this with a lot of messaging in town halls with students and their families, and making it very clear that if a student is not willing to abide by these restrictions and take on these public health responsibilities to protect the campus and the local community, they should stay at home and take their courses remotely. And all courses will be offered remotely, which will enable them to do so. But what we have learned from other institutions and from surveys of our own students is a desire to be on campus, certainly not in different time zones where they're zooming in at 2 in the morning from where they're living for their classes, the desire for access to the library, to academic departments, potentially faculty interaction, engagement with other students, even if masks are required and social distancing protocols need to be maintained. And what we've learned is that asymptomatic testing combined with contact tracing, combined with isolation and quarantine when appropriate, combined with restriction on in-campus gatherings and mask wearings, with disciplinary action for failure to comply, seems to be a successful formula that has been employed at other institutions. So before I end and kick it to the question time, I wanted to address what I'm sure many of you saw in the New York Times, I think it was just yesterday, excuse me, was an article asserting that universities and colleges may cause COVID spread in their surrounding communities. And I just wanted to make a few comments about the relevance of that article's observations to Princeton. First, and very importantly, the Times article did not distinguish between universities like Cornell that had rigorous testing and behavioral programs, as we have, and those that did not. It also didn't distinguish between communities that had reasonable restrictions in place, like closing bars, and those that did not. The article mentioned that many students involved in patient and long-term care at universities or jobs like that may have been a contributor to the community spread. We don't have, as you know, a medical school or a allied health school where that's happening. And in fact, very few of our students work in the local community at all. The article also suggested that in-person classes and campus events did not appear to be associated with significant spread, but fraternities and sororities did. Eating clubs on Prospect Avenue will remain closed through the end of the academic year. In addition, Princeton students make up a much smaller portion of the county population compared with the schools that were mentioned in the article. This spring and fall semesters have demonstrated that there's, that this spring and last spring, and this fall semester have demonstrated that there's little cross transmission between students and faculty staff. Indeed, since we began our asymptomatic screening program, there has been no transmission from students to faculty staff or vice versa. So we don't have time for a point counterpoint for all of the aspects of this article, but I would also commend you to NYU Professor Benjamin Schmidt's analysis of the underlying data for that article. He asserts that data doesn't really bear out the stories that college students generally cause increased COVID in the wider community. So let me conclude by saying that the building of our testing lab and all of our plans, policies, protocols, and physical space interventions support a culture of community caretaking that we're committed to perpetuating throughout the spring semester. So with that, Rochelle, Robin, Kristen, and I are happy to take your questions.
Okay, great. Thank you, Trevi. And we'll start with Council President Cohen.
Yeah, thank you, Ms. Williams. So it was really informative, and it sounds like you've got a great program in place. The one question I have is, at least anecdotally in town, it is said that groups of students are trying to rent private homes in town to be local. And I guess the question is, are there protocols in place, or do you have the ability to sort of not allow those students to come on campus, or, create cross-pollination between your students on campus and any students who might be living off campus? Would they have, I know you said that there are students living locally who will have the opportunity to actually study on campus, if I understood you correctly, but would that extend to people whose regular residence is not local?
Yes, so let me say a few words and then ask Rochelle Calhoun to add more information. Just to be clear, we do anticipate students will rent properties in the local community. Those students, however, will be treated just as though they were living on campus. So in other words, they would have to be part of our testing program. They would have to sign the social contract and be subject to all of those restrictions. But let me ask Rochelle to say a few more words about that.
Sure, thank you, and good evening, everyone. So we are, as Trevi is articulating, we are very vigilant in actually requiring all of our students who are enrolled students, whether they're on or off campus, to sign our social contract, which gives the off-campus students access to campus with the exception of our residential halls, but also requires them to be mindful of local guidelines about gatherings in their spaces and adhering to our own policies, our university policies about gathering. In fact, we've actually are asking students we have some instances where we have some unenrolled students, and we are not allowing those students to host our enrolled students. So we're trying very intentionally to keep down the possibility that our off-campus residences become a location for gathering in a way that we would not see as health-minded or appropriate. So we benefit a great deal from our community partners who alert us to any violations or perceived violations of those rules. And so we want to encourage the community to just let us know if there's a household that we need to visit, or there are violations or potential violations we need to investigate. In addition, we'll have two programs starting. One will be continuing a campus advocates program, which means even though we are trying to de-densify staff and faculty, there will be staff and faculty who will be on campus in zones on our campus to just be a presence on campus. And we're also beginning in the spring a community walk program, which will have individuals walking not only on our campus, these are professionals, so both faculty and staff, who will be walking not only in our campuses, but once we understand the neighborhoods where we have students housed, we will be walking those neighborhoods. So we want to be in partnership with the community and support, our students' behavior, supporting our goals of remaining healthy throughout the spring semester.
Thank you so much. Great.
Thank you. Ms. Niedergang?
Thank you very much for all coming to answer our questions. And I do have a few questions. So Ms. Calhoun, I wanted to pick up on something that you just said, and I think that would be useful. Not that I think in this day and age, we are all a little bit of the kind of secret police, reporting on other people. It's a very awkward kind of situation, but will you make available, should somebody in the community see people who they believe are students behaving in a way that they think is inappropriate, will it be easy to know what to do? Will there be some kind of reporting information, or this is the number to call, or the website, or to email? There's one. I have a couple of other questions, but.
So I'll go ahead and take that one if that's all right.
Sure.
Yes, we would like Kristen to continue to be our sort of community liaison. And so she's very good about relaying information to the appropriate staff person on campus to be able to follow up. And again, I just want to, we really do, this is a time when people are nervous about policing other people, so I think it's an important point that you're making. What we really, depending on the behavior, you should rest assured that our approach is always to help students correct their behavior. And if that's not possible, or the behavior is too egregious, then we get to more serious, response and disciplinary action. But we too just we want to be health-minded and responsible in our response. So I want to reassure our neighbors in the community that a lot of what we've heard is that they don't want to get students in trouble, and so we want to encourage people to really, just as we're encouraging our students to think about the as we've talked about, community care and community responsibility, which will be so paramount to our ability to do this well. And so the in trouble piece is less of a concern than making sure we're healthy and safe.
Okay, thank you very much. That's useful information, and thank you for that answer. I do have just a couple of other questions. One is there going to be a spring break of any kind? And if so, how will that get handled? The same protocol that you're following for arrivals. And the second question, I guess a little bit of what was the quality of the experience of the 300 undergraduates who were here, who were mostly doing their classes online? I mean, for you to decide to expand the program, there must have been positive feedback about that even with all the restrictions they had, that they still wanted to be here. So that's kind of, I'm interested in hearing a little bit about that. Thanks.
Trevi, do you want me to take those too? Yeah, okay. So
Sure.
The first question, gosh, my memory is the first question was about, remind me, please.
Spring break.
Spring break, yes. There will be a shortened spring break. It'll be just 3 days in March. One of the things you should know is that we have a travel guidelines. In fact, we restrict travel. Travel has to be approved to leave Mercer County. If it's personal or emergency travel, we have a process for that. And if it's travel for academic reasons, a lot of MCAS, LSATs, reasons, there's a process for that. Our expectation, which is being clearly articulated to students, is that students will not leave once they arrive, unless they are approved to leave. And we mean that both for on-campus and off-campus students as well. So we have processes to do that. The experience of our students in the fall, was not what they had hoped, right? We had to be very clear and sobering about how we needed to keep our community safe. And so, there were lots of limitations. We also then decided at a certain point, and certainly, before we've been seeing increased peaks, where there would be organized and approved activities that we were able to have for students, where we had designated monitors, professional monitors. For every 10 students, there was someone from the professional staff who was monitoring the activity, making sure that all of the rules were being followed. As you can imagine, when students get together, they're a little bit like magnets. Yeah. So we needed to make sure that we were able to arrange, organize, and have approved by a committee appropriate programming for students. That began to help. And also, we've really been trying to make sure that students understand not only what we don't want them to do, but how they can do certain things safely, so that they don't become so hunkered down that the only outlet is in some way a violation of policy or guideline. So we've been working pretty aggressively, not only with this population that's on campus, to make sure they have some social outlet in safe ways, but we've been thinking about that proactively for the larger community we're expecting back in the spring.
And if I could just, sorry, can I just add one thing? I'm sorry. I just, again, it's not for everybody, right? So some students will determine that they'd rather stay home or, rather stay where they are. For other students, studying rigorously and being engaged has been hard, where they are, whether it's a time zone difference or just, the atmosphere where they are. So they have to make that individual choice, but we're enabling people to not come to campus if they don't want to, because every class will have a remote component. So it's totally their choice, and they have to accept the responsibility and restrictions that we're imposing.
And just a quick final question. I know we all know the stories of some of the schools at the beginning of the pandemic. I think UNC is a classic example that brought students to campus and then, 2 weeks later sent them home. And I don't make policy at the university, but it seems to me that if you're bringing the students here, you're committed to keeping them kind of come what may and keeping them safe. And I just wanted to know if that was indeed your philosophy.
It absolutely is. And I know a lot about the UNC case, which is kind of the polar opposite of the way we're approaching this. But Robin, do you want to speak more to just the idea that we won't release students who are positive into the community to go home?
Yeah, yes. We've certainly learned that from the experiences of other universities and even here. Jeff Grosser and I meet every week, and we and talk about what's happening in Princeton and on campus. And I know that there have been cases in Mercer County where students have come back from their campuses, and so New Jersey, the state of New Jersey is also that's their recommendation, is that if you're going to open your school, that you should plan, and CDC also says this, that all the recommendations are, plan to keep them here, keep them on the campus, and that's what we intend to do.
Thank you.
Are there any other council questions? I had a couple in the interim. So one question is whether, I know the students will be tested, the plan is for them to be tested immediately when they arrive on campus. Is there going to be any requirement that they get tested before they be tested at home before they come to campus?
We are not going to require that, and I'll ask Robin to describe why not and what we are doing.
Yeah, so we did reach out to a number of campuses that did and that did that, and it's what we, because of the fact that we're bringing people in, testing them immediately, and then requiring them to be in strict quarantine where they don't leave their room. We'll be bringing them food, we'll be bringing them everything that they need. Since we're putting them in that strict quarantine, that it will, that is the route that we want to take. One of the problems with testing beforehand is that when you look at all the time that takes, because they have to take the test, get results back, and so with some of the timing, our science advisory group felt that we could accomplish pretty much the same by just having. There wouldn't be that much of an advantage to that than what we're planning to do for when they arrive. And so that's the reason why we're not looking at that right now.
And are you asking them to quarantine at home before they come, or the same thing? You're just waiting for them to come to campus and then starting them?
Yeah, I think we haven't spoken. We have not finalized this yet, but but certainly there would be a recommendation to limit their contacts and their activities before they come to campus.
There is information, I'm sorry if I could just spot, this is relevant to your question, Liz. There is information that we're asking students to provide about their health, et cetera, before they come to campus. So do you want to say a little bit about that, Robin?
Yeah, so there's like a risk assessment that happens as well, where they have to describe the kinds of things that they had done during the time before they came onto campus as well, whether that be for gatherings or if they traveled any place. All of that is information that we will be reviewing before they come to campus.
Okay.
I have one question also.
Oh, go ahead, Ms. Robinson.
Thanks, Mayor. First of all, thank you all for a very informative presentation. I believe Ms. Williams had mentioned something earlier about some sort of social contract that each student would be required to sign. Is that something that's public? I would love to see the language on there.
Rochelle, do you want to describe that?
Sure. We are currently in the phase of updating, but our social contract, and Robin, you will correct me if I'm wrong, is I believe on one of our websites, maybe the spring 2021 website, we have a what is a nearly complete social contract. So that we also wanted students to be well aware as they were making their decisions what the social contract entailed and what they would be agreeing to if they chose to be coming back to campus. So we've made it available to students and families, and I believe on our spring 2021 website in the FAQs there.
FAQs, okay, thank you.
I appreciate your response to the New York Times article over the weekend, but I think we also want to sort of prepare for the worst situation also, so we know that we're ready. And what's your thinking if there are a lot of cases on campus, there is migration of that into the community, and we have an amazing health department, as I think everybody on this call knows. But they are, like any organization, they're limited in scope as to what they can handle. And if they get overwhelmed by the number of cases and contact tracing that involves with the community cases, which I assume are going to be the town's responsibility, what's the thinking of, what can the university help with if we get to that state?
Robin, do you want to start by addressing that point?
Sure. So we are able to manage our own contact tracing. So we do contact tracing for our campus community, and we could certainly extend that more, take on more of that responsibility within for any cases associated with our campus. and including, there are some things that we have a partnership with our with Jeff Grosser and the town's health department. Certainly, we can work on ways to expand on that, to take on more of the responsibilities that the health department is taking on for our cases. Jeff, did you want to say more?
Thank you, Robin. Yeah, I just want to jump in. The ComCare, which is the contact tracing software platform that the New Jersey Department of Health provides to local health departments, is also being utilized by the university. So we're able to seamlessly kind of connect and look at different cases that might migrate back and forth. And I hear the mayor's concerns, because that's our concern too, is when you get to a point with a lot of contacts, that's the communication that I think Mayor Lempert was alluding to in the beginning is, the better that communication is happening with contact tracing, I think really the better off, we'll be with regards to suppressing any type of disease between the two, both campus and the community. So that system in place definitely helps. And I think, the weekly calls that we have, and probably more so now with the university, are going to help kind of manage some of those contact tracing efforts as well.
Do you have a sense of if the level of COVID is around where it is right now, which it's probably likely to be in January, if not worse in January, like in February? Like what number of cases are you expecting or planning for? What are your projections at this point?
Yeah, so we've done modeling, and Robin, if you want to talk about the modeling we've done, I don't know if we have those figures at our fingertips, but do you want to talk a little bit about that?
Sure. Yes, I don't have the numbers right in front of me, but I know that we were looking at, looking at how many cases might need to be in isolation, and at any one time, for instance, we were looking at a high of around 50 or so students might be in isolation at any one time. We've also looked at more worst case scenario, if there were big clusters or something like that, where it could be closer to potentially closer to 100 cases. That would be, again, really some of the worst case scenario modeling that happened. And so we wanted to make sure that we would have the capacity to be able to handle all of that, handle the having students in isolation, contact tracing, quarantine, all of those things. Hopefully, that we'd be able to mitigate that ahead of time. So we have a team of scientists and physicians and administrators who get together once a week, at least once a week, where we go over the numbers of cases on campus, the positivity rates on our campus. We look at what's happening in the community, positivity rates across in the county, case numbers in the county, what's happening with area hospitals, with testing and turnaround times for testing, and a number of other factors. We look at all of those, of what clusters we have, and anything like that. We look at those very closely, and based on that, we will recommend different mitigation strategies. So it might be increasing the frequency of testing of a certain population. It could mean changing the way that we're serving food, or it might mean more limitations on campus events, or moving to no in-person classes. Excuse me, restricting mobility between the campus and the community. A number of different mitigations that we would recommend based on what we're seeing in the community, so that we can hopefully keep our numbers low and not get to those worst case scenarios.
Mayor, also, I would add that, we have on our website, we post weekly what our testing results are. So anyone in the community can go on and see the number of tested, the positivity rate, the populations that are representative in these positive cases. And we've been doing that for a number of weeks, and that will continue so that we're transparent with the community.
Ms. Niedergang?
Sorry, I have one more question. I just wanted to follow up on what Ms. Williams said, that Kristen Applegate has been keeping mayor and council informed of those numbers. And I really appreciate that they're delivered to us rather than we have to go hunt for them. So thank you for that. My follow-up question is about impact on the local hospital. I know it's unlikely, although not impossible, that people in the, whatever, 18 to 26, 27 undergraduate and graduate population will be severely sick. It's fairly uncommon. But what are you prepared? What is the health center prepared to treat? And at what point of illness might somebody need to be at the hospital? Or, I mean, I'm assuming you don't have ventilators at the campus health center, or staff who are expert in using them. But so what are you prepared to treat on campus, and what would require you to send to the hospital?
Go ahead, Robin. I see you nodding.
Sure. So our infirmary, we do have an inpatient infirmary. So we do have a place where people can be for observation, and there are certain things that they would be able to do. They couldn't put anyone on. We don't have a ventilator or that level of care, but they would be able to. They would be able to monitor someone, oxygen, but certainly they would want to transfer them to a hospital if there was a chance that someone would need care that's best done in an intensive care unit or anything like that.
And has anyone at this point needed that? I don't want to ask for anything that would be confidential, but has that happened?
Not, we have not had any students that have needed that level of care.
Thank you.
Jeff, did you have your hand up? Or
I scratched my.
Okay, sorry. What's your what do you see as the role of the Princeton Health Department in this, in terms of helping to manage the students coming back and then over the course of the semester, in addition to the communication?
So we meet weekly, and I think that it would be the same type of support and collaboration that we've been doing over the past several months. We're again, as I mentioned, for contact tracing, we're able to do everything for our own campus community. So we reach out to the health department for help when there is a person that's, say, a close contact that's outside of our campus community, and there needs to be, say, quarantine orders or something like that. But generally, Jeff has been incredibly helpful in helping us to keep up with what's happening in the state, what guidance is changing, and what's happening in the town and in the county. And Jeff, do you want to?
Yeah, I just wanted to echo that. I agree. I think a lot of it's the communication with the contact tracing and going beyond, the normal questions in terms of, obviously the university is going to have a set of questions they're going to ask, but we're going to have obviously questions for the community that we're going to make sure that, the individual works in town, were they off campus, and those relationships and how that plays into the disease transmission is really big in terms of, again, suppressing the disease. The university has their testing capabilities on campus, but we want to make sure that those, if those cases, come off campus, we stop them before they spread too far. And then further, just working with the university, obviously through the fall, we utilized a set of metrics with closures for schools. And I think just not in terms of closures, but in terms of what to do with particular groups of, obviously in the campus life, it's going to be a little bit different, but just having a metric in place to discuss, when do you start putting more restrictions in place on campus? I think those are just conversations in terms of how is the disease working right now, what's happening with the test results. We're going to find out a lot of information from those first few tests that the campus performs. And I think based upon how the quarantine's going, those first couple of weeks are not going to be really the signs of what's to come. It's going to be those few weeks after the tests have come in and we've got everybody kind of under quarantine. What happens once students get to remote learning and they're living on campus and life gets back to somewhat kind of normal on campus? That's really when we need to start really getting into how do we protect both the campus community and the community at whole, because that's when people will typically let their guards down when they think that they're safe. And we saw that in the fall. So I think we just need to continue these conversations. The contact tracing can't let up. We've obviously been doing contact tracing for a long time. Our public health nurse is going to be working with university health services and the EHS with the university to make sure that everybody's on the same page with their contact tracing. But at the end of the day, like you said, Mayor, it's going to take communication to make this work. So we need to keep having these conversations. And, if there's issues on campus, we need to be able to help them. And if there's issues off campus, they need to be able to help us.
Great, thank you. And I just have a final question about, you had mentioned learning from other campuses, and Cornell has been mentioned a couple times as a university that seems to, relatively speaking, did it right in the fall. And I'm wondering, are you in communication with them about what they feel like their lessons learned were and what they're doing for the spring? And are you sort of modeling some of your policies after what they're doing, especially how they're structuring this their spring semester?
Yeah, so let me turn to Robin in a moment, but just to say, myself, the provost, Rochelle, Robin, more than ever, we have been speaking to our counterparts at other institutions. So I have a weekly call with EVPs at 35 research universities, including all the Ivies. Same, the provost has the Ivy Plus call, Rochelle has her equivalent, and Robin. So we have, for the entire fall semester, we've been taking in lessons learned. We also, the provost office did a deep dive and a cross-section of institutions to get their information. And then we've been connecting again at different levels in different parts of the institution with our counterparts. So I think I understand. I did mention Cornell. They've been, I think, very helpful and a good example, and Robin can certainly speak to that. But I just wanted this group to know that the intensity with which we have tried to learn from other institutions has been, I think, unprecedented. So, we really feel like we're coming armed with the knowledge that's out there as we approach the spring semester. Robin, why don't you talk a little bit about Cornell? And Rochelle, you had mentioned the Community Walks program. That's something that came from Cornell.
Yeah, so Cornell has a large off-campus population, even in the non-COVID times, and so we learned a lot from listening to them about how they including their off-campus students in testing and the way that those interactions happen. I think most of the things that we're doing are things that we're planning to do for our spring semester are things that they've been doing and doing very well with all testing, isolation, quarantine, all of the different aspects of that. I can't think of anything else very specific, but what we're doing is very much in line with what they have been doing, and a lot of other schools that have had pretty very positive experience in their fall semester. Rochelle?
The only thing I would add is that our colleagues at the different institutions, the universities and colleges, have been incredibly generous with information and incredibly candid with us. So they have shown us sort of their pitfalls and helped us to think through not how to have those things happen on our campuses and in our communities. So we're always, really happy to have such good colleagues, but I've been very impressed with how open and candid they've been to sort of help us all put our best foot forward as we move forward.
That's a very good point.
Great, thank you. Are there any other questions for the university at this point? Okay, well, I want to thank you all for for having this discussion with us. And I know this feels like in some ways the beginning of the conversation as students are welcomed back because it is obviously it's a huge undertaking for the university with huge impacts, but also on the community side too. And we want to be working in partnership with you to keep everybody safe and to make this a successful bringing back of students. So thank you again for your time tonight and to be continued, I'm sure, in some form.
Well, thank you very much for having us. As I agree, the communication is critical and the partnership, and we really, really appreciate the opportunity.
Thanks. Jeff, did you want to say any sort of final words on this or give a report to council? I know there's been a lot going on with on other aspects of COVID.
I can give a brief update. I appreciate that, Mayor. No, and nothing directly to the university. It's actually fitting that they're speaking tonight just with the arrival of the first doses of the vaccine into New Jersey. It looks like tomorrow, well, today, but the first dose is being given tomorrow. We're working actively with our community partners on vaccine planning. And obviously the university will play in that too, especially for their healthcare workers, which will most likely be a prioritized group. We're hopeful that community clinics set up for community health or community healthcare workers that fall outside of those healthcare systems and first responders will be receiving doses in Mercer County within the next 2 to 3 weeks. So right now, the Princeton Health Department is working with our other municipalities on trying to set up those clinics. We are literally working each day with new information. Today, the New Jersey Department of Health released a new scheduling software that's going to assist us with, or assist residents with pre-registration, assist health departments with scheduling, and then also insurance billing, and then following up with the secondary dose, which will help with scheduling for that shot as well. So there's a lot of planning right now, and vaccine information going out to our first responders and those groups in the coming 2 days, really. In terms of caseload, we are continuing to see 5 to 6, 7 cases per day. There's really no slowing this thing at this point based upon what we've seen in the community. The cold weather certainly hasn't helped. And unfortunately, Princeton's really actually we're actually doing pretty well with comparison to the rest of the county. However, the vaccine is really our only way out of this at this point. So we want to make sure that we're putting out the right information to residents. So there's going to be a huge educational campaign coming from both the health department and also the municipality and the Department of Health to make sure that individuals are making educated decisions about the vaccine. So a lot of information to come. And I appreciate, again, the communication with mayor and council. Obviously, we're trying to get you everything that we know, and sometimes it's daunting for us to try to put it in a condensed form. So I appreciate the opportunity to speak to everybody. And obviously, anytime anybody has any questions, you're more than welcome to send them our way.
Well, I just had a question with the contact tracing, because now we're, like 3 weeks, maybe 3 weeks out from Thanksgiving or so. I know we really tried to push out the message for people to be careful and to change their normal family gatherings for Thanksgiving. And do we have a sense of the cases that you're seeing? Are those being tied back to Thanksgiving celebrations, or is it hard to tell?
So coincidentally, yeah, leading up until this past weekend, we did not see any signs of Thanksgiving related cases that were stemming from Thanksgiving with the testing. This past weekend, unfortunately, we probably saw some of our first cases that were stemming from Thanksgiving gatherings. It took a little bit of time. I know Dr. Fauci and the CDC we're talking about a 2-week lag. So we saw a little bit beyond that 2-week lag with our cases. So over the weekend, we did see a few cases that came in as a result of Thanksgiving based upon some of our case investigations that were performed today by staff. It looked like some of those were tied to Thanksgiving events. Where we did see a slowdown in cases or a plateauing of cases was really when fall sports ended and we stopped seeing the competitive sports, the tournaments, the youth clubs, travel sports. We stopped seeing those exposures and the spread there. However, with that said, we are really seeing it kind of across the board at this point. I know a couple more schools in the Princeton Public School District had some staff exposed in the last 48 hours. So we're just unfortunately seeing it, coming from kind of every angle. In the beginning, we could quantify, seeing it from employment, seeing it from occupation, seeing it household contacts, seeing it social gatherings. And right now, it just seems like it's coming almost from everywhere. And it's just spreading so quickly. And at this point, it's difficult to keep up with. And I think that's kind of part of our, internal concern at the health department with regards to contact tracing. We're starting to see more, we call them ghost exposures, where individuals really have no idea where they came from. You're starting to see more of that. And that's our biggest concern from contact tracing, because you can't suppress community transmission at that point. So again, if we didn't have a vaccine on the horizon, I'd be a little bit more concerned about it. However, I think what we need to weigh right now in balance is the vaccine planning and then also the contact tracing. So we continue to hit both at the same level, because the one thing about contact tracing is if you don't put the time and effort into it, I always try to metaphorically speak to, especially our interns that help us, like cramming for an exam. If you have one exam in your semester, you have one class, you're going to put all your time and effort into that one class and you're going to do well. But if you have 7 classes and you overloaded your coursework, the odds are you're not going to put the same time and effort into all of them. You might focus on one more than the other, and one class is going to suffer. And I think with contact tracing, our issue is when we can't put that time and effort into those contact tracing cases that we want to, we end up losing the quality that we want out of them. And what ends up happening is we miss a part of the story that impacts another cluster of cases. And quite frankly, that's what, really, I don't have any time for. So we need to make sure that we continue to do that at an A+ level to make sure that we continue to suppress the disease while planning for the vaccine rollout.
Thanks, Jeff. Ms. Niedergang?
Thanks, Jeff. And now not only do you have multiple fires to put out in terms of contact tracing, but now you have to spend a lot of time on administering and planning for the vaccine. So suddenly your work, which up till now, I'm not saying has been only contact tracing, but that's been a lot of the effort. Now you have like all of a sudden a whole new task that has, really is going to occupy a lot of your time. So I guess my question is, are there additional resources that you need that we might be able to provide to make your job easier, better, can do it at a better level? Or do we just have to muddle through, I guess?
So there's a series of meetings coming up with the municipality and the county, and I think a lot of what's going to help with the vaccine rollout is a coordinated effort. You're absolutely right, Councilwoman Niedergang. I think with regards to resources, some of the best resources we have in Mercer County is the fact that we have an unbelievable public health nursing staff kind of broken up into different health departments, and they're all coming together to assist with the vaccine planning. What we need to work out is, and this is part of the planning, is coordinating those efforts so we can get as many people vaccinated as possible based upon the priority groups, similar to how the university is bringing back students to kind of slowly work their way in and go through quarantine. We need to also slowly work people in to get them vaccinated, because the mass vaccine clinics are not going to start up until probably early spring, possibly late winter. And those are the large scale stadium type vaccine clinics you've probably seen or heard about. For now, they're going to be a few hundred people, maybe 1,000. They're not going to be massive. And in Mercer County, we can only do that with a coordinated effort. So I think, what's already being done that's really helping us is the communication that you're all putting out and working with the mayor on their newsletter. When things go out there, a call to action for nurses, volunteers, we get a tremendous outpouring of support. And I think that's what really can help us through this process. We're working on a volunteer registration. It's going to be a digital form. It's going to take into account all the different positions that we'll need in the vaccine clinic. So we're going to ask for that to be distributed, and then we're just going to ask for word of mouth for people to sign up, because that's the best way that we can really get these clinics rolling from a workforce perspective, because we're not asking for people we'll handle all the vaccinators. We're not looking for residents to vaccinate other residents, but we will need help with, the flow of people, getting the message out to the right people, even administrative support. We're dealing with the new software at the state. Data input's going to be a big thing. Obviously, people are worried about health information, but we'll have that covered. But there's going to be pieces of registration and things like that we really could use community support on, whether it's people telling their neighbor about it or just, coming out and assisting us with making sure people are socially distanced. There's a lot of things we have work for people.
Keep us informed.
Will do. Thank you.
Thank you.
Thank you. All right. So I want to thank again all the university representatives, and you guys are welcome to stay, but you can also say good night too, if you'd like to. But thank you very much.
Thank you.
Thank you.
Thanks. Okay. So we have our, I actually wanted to mention 2 websites that the university has up for if there's anybody listening who wanted to get some more information about the university's plans and the campus contract that they're asking students to sign. So one website is covid.princeton.edu, and the other website is spring21.princeton.edu. Okay, so I want to move now to our third presentation this evening. And this is from the Civil Rights Commission and members of Not in Our Town on the Princeton Racial Equity Impact Assessment Toolkit. And I wanted to ask Councilwoman Fraga if you had any introductory remarks before we pass it over to the CRC group.
I believe that the chair of our Civil Rights Commission is going to be giving the intro, but what I can say is that the Civil Rights Commission has been working on this toolkit for at least 5 months, I believe, and this is a result of follow-up from the resolution that Mayor and Council passed back in June, adopted back in June, declaring racism a public health crisis. So this is a follow-up from that, but I'll let Mr. Parker do the intro.
Okay, great. And I would like to introduce Tommy Parker, who's the chair of the Civil Rights Commission. And I also see Ashin Shamsi and Surinder Sharma and Linda Oppenheim, who've also been helping to work on the toolkit. So welcome to all of you.
And also Jean Durbin, I believe, is a member of this.
Oh, Jean Durbin. Sorry, I didn't see your camera was off, so your name didn't pop out. But yes, and Jean Durbin also. Thank you all for your work. And Mr. Parker, do you want to start this off?
Yeah, thank you, Mayor, and Council. Thank you all for having us here this evening to make this presentation. This is a truly a collaborative effort, and I'd like to thank the committee members who you've introduced: Afshin Shamsi, Linda Oppenheim, Surinder Sharma, and Jean Durbin. And in light of the season that we are currently living in, and how the disparities in equity have been ultra highlighted, not only by the events of this past spring with the deaths of Breonna Taylor and George Floyd, but also what COVID-19 has exposed in terms of the disparity of consideration and care for our most marginalized community, largely Black and Brown communities. Also, in light of the age-old question and concern about systemic racism, prompted by, as Ms. Froggy pointed out, but also prompted by conversations with the mayor at our civil rights meeting. She asked us to take a look at this matter, and we have been going at it since June, in concert with a beautiful letter from Not in Our Town to the mayor, commending them for the resolution on racism, but also indicating some suggested remedies that we can go about to answer some of these questions as it relates to equity and systemic racism. So the next person you hear will be Afseen Shamsi, and she will lay out the Princeton Racial Equity Impact Assessment Toolkit and the recommendations from the CRC to adopt this process in whichever manner. Following that, you'll hear from Linda Oppenheim. So without further ado, please, Ms. Shamsi.
Thank you. Thank you, Tommy, for that introduction and also for your leadership of the commission and this project. So Mark, can I ask if I could just share my screen very quickly? That would be helpful. If not, it's not a big deal, but it may be helpful. Okay, so given that we can't do that.
Actually, I think you should be able to. I just tried to share my screen and it seemed possible. So
okay, let's see.
I can do it. You should be able to do it.
Hold on, let's try.
Yep.
You get to see my very messy desktop. Sorry about that. Okay, here it is. So thank you, Tommy, for your leadership of the Civil Rights Commission and this project. This summer, Princeton's Mayor Lempert and Council passed Resolution 2195 declaring racism a public health crisis, and by doing so, made a commitment to review all of the municipalities' budgets, programs, activities, policies, guidelines, and procedures through a racial equity lens. After consultation with the Princeton Civil Rights Commission, Not in Our Town reached out to you to ask you to consider adopting a racial equity impact statement in order to accomplish this goal. Thus, the Princeton Civil Rights Commission was charged with and developed a racial equity impact assessment toolkit to fulfill that commitment. I want to take a moment to thank you all for your leadership on racial equity in Princeton. It makes me truly grateful to live in Princeton, to have leaders like yourselves. The ad hoc committee was formed to work on drafting the toolkit, and the committee looked at models from other cities and developed a toolkit, which is a series of questions specific to the needs of the Princeton community. One of the goals in the development of the toolkit was to ensure that it's not burdensome on those charged with using it. Once the toolkit was developed, the committee tested it by applying it to existing Princeton policies and ordinances. Our conclusion is that the toolkit in its current form works. However, we recognize that as the toolkit is used by the municipality, it will continue to evolve to address new and changing realities on the ground. Thus, we see the development of the toolkit as an iterative process. Our recommendations regarding the implementation of this toolkit to council are: it's the CRC's recommendation that the toolkit be adopted in the development of all new and revised policies, programs, HR processes, and budget line items, such as projects or programs prior to those items making it into the budget. We also recommend that the toolkit be used to examine existing programs, policies, and processes that are currently in use through a racial equity lens. The CRC built into the toolkit the means to solicit input on the municipality's programs and policies from community stakeholders. We believe it's essential to consult and get the perspective of impacted communities in the development of programs and policies. It is also the CRC's recommendation that since the goal of this toolkit is to address institutional and structural racism at the municipal level, therefore it is essential that municipal leaders and staff receive ongoing training for racial equity and implicit bias. There's an abundance of evidence and research that demonstrates that implicit bias is prevalent throughout our society. And if this initiative is going to be successful, then it's essential that the people using this toolkit understand what implicit bias is and why it's important to address, and how the toolkit can help them do that. Finally, it is the recommendation of the CRC that once the use of this toolkit is approved by council, the toolkit be piloted with a municipal department or commission. We're recommending piloting it with the engineering department because it touches every part of town. The CRC will continue to work with the municipality in this pilot phase of the toolkit to ensure its successful implementation. With that, I'm going to hand it over to my colleague who's been a tremendous leader in this effort, Linda Oppenheim from Not in Our Town, who's going to cover the FAQs that we developed on the toolkit for the benefit of those using it and for the general public.
Thank you, Afseen. And I'd like to add my thanks to the committee members, to Chairman Parker, Mayor Lempert, and council members. Afseen has already talked about how the toolkit came about. I also want to give credit to Dr. Linda Dodd, who's on the faculty of the School of Public and International Affairs at Princeton University, for bringing racial equity impact statements to our attention when she introduced the idea at a meeting of the Board of Education's Equity Committee. The Board of Education is developing its own racial equity impact statement. Now for the what, why, how, when, and where. The toolkit provides a systematic examination of the impact of proposed or existing municipal budgets, programs, policies, activities, and so forth. The goal is to prevent structural and institutional anti-Black racism and to minimize the adverse consequences to historically marginalized communities and thereby addressing longstanding racial inequities in Princeton. We know equity is an important Princeton community value. We recognize also that racial disparities exist. Nationally, white people have 10 times the median wealth of Black people, while in New Jersey, according to the New Jersey Institute for Social Justice, the difference is 50 times greater. The Princeton population presents a similar picture. Structural and institutional racism contribute to these disparities, and Princeton's history of residential and educational segregation is a factor. The toolkit is designed to facilitate intentional and thoughtful municipal decision-making with an awareness of the potential negative impact on historically marginalized communities. We see the toolkit reinforcing Princeton's commitment to addressing institutional racism. Those of us who are white, and even people of color who are not African American, have a disadvantage. We have not had the life experience of African Americans, which means that we are less likely to notice when decisions will potentially put African Americans at a disadvantage. By using the toolkit, we can identify new options for achieving change in addressing implicit bias and eliminating institutional racism. We see the toolkit being used prior to enacting new budgets, programs, or policies, much like environmental impact statements, fiscal impact reports, and workplace risk assessments. It is the Civil Rights Commission's goal that using a racial equity lens will become second nature in doing the municipality's work. Racial equity impact assessments have been used in the United Kingdom for over a decade, and in the United States in cities and counties, including King County in Seattle and Washington, St. Paul in Minnesota, and the states of Colorado, Iowa, Connecticut, and Virginia. Afshin?
Thank you, Linda. And now I'm going to share with you the actual questions in the toolkit. So at a very high level. So essentially the toolkit starts out by asking basic project, program, or policy related questions, such as the need for the project, resources required, and goals. Once those questions have been answered, it delves more deeply into the questions of who would benefit from the project and who would be burdened by it, and then, or of any unintended consequences. The developers of the program or policy or project are then asked to provide solutions to address any adverse impacts of the program in question. The next step is securing stakeholder input and then incorporating that input into the program. And then finally, how they would go about measuring the success of the equity goals in the program and also reporting on that success. And then finally ending with, after the process is complete, because we engage stakeholders in the process, what needs to be communicated to them to close that communication loop. We also developed some resources for the developers of the project, program, or policy, and I'm going to hand it over to Linda so she can share those with you.
There are three lists that we compiled to provide resources to ensure the successful implementation of the toolkit. The first exhibit is a series of organizations that provide training about implicit bias and racism. And this is not definitive. There may be more, and we're always happy to grow that list. But we provide what organization, how much time commitment their training would be, what the cost would be, and the contact. So Afshin, if you could scroll down, you could see the rest of that, of the list. Also, I want to point out, if you stop where it says Princeton Public Schools, there is an online course that's being developed. I think the first rollout of it was this fall for staff in the district, and students will also be able to participate in the winter, and they're supposed to be a community availability in the spring, so that's something to watch out for. In Exhibit B, very briefly, we note that the municipality is always looking to improve communication, and we want to start listing the ways that, and things that are certainly familiar to you and that I know that you're already using in various circumstances, but ways of gathering input to make sure that as many people's voices are heard, particularly people whose voices are sometimes difficult, whose input is sometimes difficult to acquire. And then Exhibit C, again, not definitive, but a beginning list of potential community stakeholders who could be consulted in terms of the implementation on any particular issue, on some kind of proposed activity or policy.
So that sums up our presentation. And once again, I just want to acknowledge and thank Tommy Parker for his leadership, and also Mayor and Council for your leadership on this project and considering it and leading it, and your commitment to racial equity. And my fellow committee members, Linda, Jean, and Surinder, this work was born out of collaboration between all of us, and so thanks to all of you. And if you have any questions for us, now would be the time.
Mr. Cohen?
Thank you very much. Yeah, go ahead.
I'm sorry, Liz.
Go ahead, David.
Thank you. It's not so much a question, but I'm particularly, I think what you've presented is a fantastic start. I noticed that one of the questions late in the list of questions was, what measurements should we be doing to see whether the policies that we're implementing are working? And I think that data-driven policies, can really reveal sort of hidden opportunities for improving things that don't necessarily occur even to the stakeholders that you're talking about involving in the process. I had a conversation with Heidi Fichtenbaum last week, who was talking about environmental justice or environmental equity, and mentioned to me that the CAPERS team, which is the Climate Action Plan group of Princeton University students and graduates who help do data analysis for the Climate Action Plan, might be a really good resource for you all in identifying different metrics in town. Like, I've seen these maps of the effects of redlining in cities across America, gathering data about housing prices and distributions of where people are living and stuff like that. And there are just lots of other kinds of metrics as well one could imagine helping to guide policy in an equitable direction. So I wanted to try and make that connection. I actually had forwarded to Leticia and to Tommy Heidi's information so they could pick up on that. But I'm really happy to see Surinder here, because he and I have had conversations about science and bringing a scientific mindset to policy making in town. And I think that this is a fantastic opportunity to do that. And I'm glad to see he's on the team, because he'll be really helpful in moving that piece of the agenda forward.
David, if I may respond, you brought up redlining maps, and I get to a shout out to my husband, Bob Karp, who recently put together a map of lead poisoning in Brooklyn, which almost identically overlays redlining. So
Right.
it's that kind of revelation that's going to come about by using those methods.
Exactly. And I think this group could be a real help.
And that's also a possibility of the overall second nature of how we do things, David, in terms of how the municipality operates in support of the community. And one of the conversations is like really kind of an age-old conversation, relatively speaking, is about environmental impacts on various communities, and largely our communities of color, our low-income community. In fact, we had a presentation from Sustainable Princeton, the theme of which was the impact on something that we see every day and may not think of, like lawn servicing and the equipment that they use. All right, and how the direct impact on the individual using that, and the impact on the environment, without any kind of real consideration or protections put in place. And this toolkit kind of makes that kind of part of your overall consideration when we develop these kind of contracts or things of that nature.
Ms. Prone-Lampros?
Thank you. I just, first of all, just like to thank my colleague, Councilwoman Fraga, and the entire Civil Rights Commission, and under the leadership of Chairman Parker. This is tremendous work. I think anything, in life worth doing is never easy, and this is certainly going to be very worthwhile. I, for one, am very interested in further training. I see a lot of information there. There are a lot of things that we're doing, decisions being made, such as, for instance, the internal committee we have, Council President Cohen and Councilwoman Sachs and I have a redevelopment and planning committee. This very much should be, we should have this lens on at all times as much as we can, but I think for myself, further training would help. And of course, the finance committee, really, this just touches on everything. So as much as you can help us, or I'd like to, try and make this a commitment in our goal setting in our retreat. We talk about it, but we have to see how we can really implement it. So, and I just thank you very much for taking this on. Appreciate it.
Thank you, Councilperson. And part of the civil rights mission in general, and as Ms. Oppenheim pointed out, in the list of resources and available activities we have developed in our program, not only in concert with this initiative, but the town hall meetings, and we have established trainings over the season that deals with implicit bias and things of that nature, and also in concert with the Attorney General's Office, Division of Civil Rights. There have been one of our collaborators in the past that has helped present dialogues and start these kind of training processes. So thank you for that statement, and it is something that is absolutely ongoing and built into our mission.
Mr. Williamson, and then Ms. Niedergang.
Thanks, Mayor. First of all, thank you all who worked on this very worthwhile and very necessary project. My question is more on the implementation side. I don't know if it was Ms. Oppenheim who mentioned earlier about our engineering department would be the first department where we're sort of going to I guess, test what's in the toolkit with. I just wanted to get some more information about how does that physically work with, let's say, head of engineering Deanna Stockton, and like.
Yeah, can I just interrupt? So I think
Sure.
that was a suggestion, but I
Okay.
feel like that's sort of maybe jumping ahead. And
Oh, okay.
I think just in terms of next steps at the end of this, I'd like to sort of bring in Mr. DeShield and talk about sort of next steps on how to roll this out.
Okay.
And what would be involved and what makes sense. You know, just in thinking about this and having it be, you know, a lot of the questions fit really nicely with projects. So I'm wondering if one arm of it might be anytime we have a task force, and we have some active task forces right now, because those are all shaped around a project. You know, whether it's the permit parking task force, or you have the redevelopment task force, even, you know, like the dog park task force. I mean, I think you can see like these questions being posed to the task forces. In terms of bringing it to the departments, I think it's better to have maybe Mr. DeShield talk about how that might be implemented and how to break it up into steps, like what that first step might be for council to sort of consider for 2021.
And Mayor, if I could also add in fact, in the language of this, the toolkit would be suggested to be applied in not just across municipal departments, but the boards and commissions, the various task force, you know, all to kind of adopt this second nature, this lens to view what it is that is being planned, and you know, the unconsidered consequences, things of that nature, but especially as it reflects to kind of disengaging unthought of or unconscious bias, especially as it relates to racial equity.
Yeah, agreed. Mr. DeShield, did you have any thoughts you wanted to share at this point about
Mayor.
you know,
Thank you.
what sort of some next steps might be?
In terms of the staff, I think the next step is really important that as they've been talking, it's an implicit bias. So that requires that we train our employees to understand how to make these decisions, how to identify those biases that we don't consciously see. So I think the first step in this process has got to be some additional training on understanding what those biases are that we all have, and understanding how they fit into policy. So I think the first step is across the board, particularly at the department head level, is to get that training done, to identify that training. Then I would suggest that the toolkit that you have, just some modifications. Some of this may fit well with projects. There may be a way of streamlining, you know, the questions to fit different things. One set of questions may be more akin to projects. You may have another set of questions for just items that go into the agenda on a regular basis that can be analyzed. So I would suggest the first step is maybe it's a meeting with the department directors, this subcommittee of the board, to just explain the process, have a conversation. Let's see how we can implement this process.
Right. And Linda, I've seen jump in here. Even the recommended suggestion of the engineering department, for instance, was as much about how does this toolkit fit in to how they make decisions or the work that they have to do, as suggested that should be the only one that we're suggesting that you look at. So that's a fair statement, Mr. DeShields, in terms of that, because if you do look at the questions, some of them are more germane or at least in relationship to what some of your various boards or task force would do, what your various departments do. Engineering became an interesting model because, number one, it's one that no one actually thinks of in that sense. They have a specific job and duty, all right, but it's more about how that job or duty, the thoughtfulness that goes into that, how it may impact various communities. It's the one department that actually touches every community, like with decisions on how you streetscape or anything else. You know, it's kind of across the board. But yeah, I mean, what you
Mr.
said.
Cullen? Sorry.
Yeah,
Mr.
I just wanted to, flesh out a little bit what Tommy was just saying. I think that implicit bias training is super important as a first step, as Mark was saying. I'm going to give the example for those who are familiar with it of the green building checklist that is required of all applicants for land use applications. And for those of us who've sat on the planning board, you know that some applicants, for some it's a joke. You know, they answer the questions, but they don't put any thought into it, and the checklist is worthless. For others who really know something about green building, they take it seriously, and it's a real useful tool for moving their projects in a more environmentally friendly direction. I think this is the exact analogy of this toolkit, is until people who are filling out the questionnaire have had the implicit bias training, the questionnaire will not work. You need to sensitize people to the issues and then get them to use the questionnaire on their specific projects or policies or initiatives.
Ms. Fraga?
Yes, I just wanted to say before we get too much into the weeds, I wanted to point out that the mention of the engineering department, from what I understand, was just used as an example. But I think any further discussion should involve the departments that we're talking about how this might be used. Definitely the training is the first step that would apply to everyone, but anything else should involve whether we're discussing a department or whether it be we're talking about council. And like Chairman Parker mentioned, it would also include the BCCs because they do make policy recommendations. So we would also want them to be, if we're going to, and I'm not sure if we're going to do this through a resolution, that we are going to suggest, if we're making the suggestions that everyone, all these departments or BCCs or council use this toolkit. I don't know if this is something that we would do through a resolution.
Doesn't the resolution already exist? Doesn't this fall under the purview of 2195?
And
I think
that's what
yeah.
I'm asking.
Well, I think that it's, I think the intention is, was part of the original resolution. I think this is more, it's more operational in a way of just, I think this toolkit is, I think these are really great questions that are, I think are going to make what we're doing better across the board on a lot of dimensions. And it's more just how do we operationalize that, right? So it's, and this is where I'm turning to Mr. DeShield, because a lot of this is sort of like nuts and bolts, and we're not going to sort of figure it out at the meeting tonight. But I think the next step, I think, is really to turn it over to administration, to take to the department heads and sort of work through how this might be operationalized, especially as a first step, how it might, the training component, and to put together a plan that would then be brought back to council. But go ahead, Mr. DeShield, if you wanted to.
And what I was going to say, I think the pilot, if you wanted to do a pilot, is on all of the departments, department level, and then you can move on to BCCs. That way we can kind of figure out all the kinks in the process and figure out a process that we can then easily implement in our boards and our commissions. So I would suggest the first step would be the subcommittee meeting with our department heads, and let's begin to have a conversation about how do we operationalize this process.
Right.
Ms. Niedergang?
I don't have anything particularly original to say, but I would just like to thank everyone on the Civil Rights Commission. Looking through this, not only does this have incredible value to, help us think about the ways in which we make decisions to ensure equity, but they're just really practical and really important questions that we should be asking ourselves every day, all day, about what we do and the decisions we make. And so I was really impressed with the work that you've done and the questions that you're asking. I mean, I think this is not going to be an overnight proposition. I think, you have great support here, but it takes a long time for people's minds to form in the way that they do things. But I'm eager to jump into this with you, and I hope that I won't speak for all my fellow members of council, but I'll echo what Councilwoman Perrin-Lambros said, that I personally would love to participate in something like this. So I hope you'll help work with us to find a way in which council members as well as staff can be a part of some kind of training and really learn how to use this toolkit appropriately, asking the right questions. So again, just thank you for, I cannot imagine how much work this must have been. So thank you for bringing it to us.
Yeah, thank you. I just want to echo that too, is that the resolution we passed declaring racism a public health crisis was really a statement of values, and we wanted to have those action steps be as concrete as possible, but we also wanted to move expeditiously, because when there's a crisis, you have to sort of do both. And this presentation has really brought us far to get to something that is, real concrete questions that are going to help the policy and decision-making of this body and of the town. And I just want to thank you for the work and for all the resources that are listed there. It's just an incredibly helpful body of research that you guys have done and presented tonight. So thank you.
Thank you all for having us. And just in consideration of actually the work that was done and what was suggested there, and what Mrs. DeShields is speaking of. In fact, that was one of the recommendations and ask also that CRC in concert with the municipality would continue to work to bring this process to fruition, and the unconscious bias training and others and implicit bias are things that CRC through its partnership with its community stakeholders is available to do and able to do as we have done this in the past. What comes to mind, in fact, is that Ms. Oppenheim mentioned the schools initiative towards creating an impact statement. But about a little more than a year ago, maybe 2 years ago, Civil Rights in partnership with the school did a study circle, and one of the things that drove that, in fact, was the equity report put together by Dr. DeBose. And one of the things that she said that hits at the heart of this in all of our considerations and concerns is we can't intellectualize away a matter. We have to actually form a relationship, and this is a great way for us to form a relationship with the community and all of us that serve this community, and making sure that we're not leaving anybody behind by any consideration. So I say all that to say that we absolutely are available to continue not only working on this project, but to put together a program for the unconscious bias training as well. It's what we do.
Thank you.
Thank you.
Are there any final comments from council? And if not, then I think we've outlined the next steps, which is I'm having Mr. Shield take this to the department heads and having some representatives from CRC come and make the presentation there too, and
Awesome.
work on some next steps. So thank you so much.
Okay,
Thank you again. Absolutely.
thank y'all.
Amazing.
Thanks. Okay. Now we come to the public comment portion of our agenda, which is a little later tonight than we normally have. But I did want to open up the floor to anybody who'd like to speak on an item that's not already on the agenda. And I see Diala Ghazal.
Yeah, that was perfect.
Go ahead.
Can you hear me?
We can, yes.
Okay, great. Thank you. I'm going to speak tonight about leaf blowers. I know it's a topic that may seem trite amongst all the serious problems that was discussed tonight, but it's something that weighs on me and other residents. And I want to be a good role model for my kids and try and solve the problem I see rather than just do what I normally do and complain to my husband about it. So I'm hoping this group can help me. We moved to Princeton 2 years ago and we love it here. I have 2 small children and working from home has been a blessing because I can take breaks and take them outside. Unfortunately, the walks are often disturbed by the excessive noise and air pollution from the leaf blowers in the neighborhood. We live across from La Jolie Salon, which is on Lee Avenue, and twice per week, every single week, I stare out my window at the leaf blowers out in full force. Last week, I had a job interview over Zoom, and they were so loud, I had to pause the interview and text my husband asking him to go downstairs and just beg them to stop briefly so I could hear the interview. Of course, they didn't stop and they carried on because that's what they're hired to do. There weren't even any leaves in the lot. It was just blowing dust around. And their response to him was that they were paid to use the leaf blowers for an hour, no matter what, even if there were no leaves. Sadly, to me, what that means is we're just emitting air pollution all over the town when there may not even be any leaves to gather. Often as we take walks in the town, all the leaf blowers are emitting fumes into the air, and it reminds me of the old polluting cars. I worry about what this does to small kids, their little lungs and developing brains. I know people with asthma and allergies suffer greatly due to leaf blowers and what they blow into the air. And it also destroys our peace and quiet, which I'm sure we're all desperate for at this time since we're all home. At the very least, I think that there should be some limitations and requirements around electric leaf blowers, for example. I hope we can all come together and make a change as they have done in other communities across the world. I'm really inexperienced when it comes to civic matters, so I'm hoping for guidance from this very experienced group on what I can do next to help make a change. Thank you.
Thank you very much. And I know you're not alone in caring about this issue. I think it has been one of the issues that's come to the forefront because people are spending more time at home and trying to work at home, especially during the day. I wanted to ask, I don't want to put her on the spot, but Councilwoman Niedergang has been working with the Environmental Commission on this issue. And if you wanted to just give folks who are interested in this issue an update on where the Environmental Commission is and if there's a place for them to plug in there to make their voices heard and to help shape a policy solution on this.
Right, so I'm going to use this. I have a report that I was going to give, and it's kind of a perfect segue between what we just heard about thinking about the issue of racial justice and equity and the issue of leaf blowers. So I want to report on a grant proposal that Sustainable Princeton has received that we'll be working on. And this is something that will be done with a bunch of community partners. The grant is from an organization called Partners for Places. Princeton was one of 9. cities selected nationwide to have programs, and it's a combination of environmental sustainability and social justice and equity that this organization is focused on. So Princeton's proposal, and there'll be the Princeton Environmental Commission will be working on this, along with several of our other boards and commissions, Human Services Department and Commission, the Board of Health, the Civil Rights Commission, and community partners, Unidad Latina en Acción, the Latin American Legal Defense and Education Fund, Rutgers School of Public Health, and Quiet Princeton. And all of these organizations are going to be working together to come up with a way of, first of all, finding out about the practices that local landscapers are using, what drives them to use those particular methods, and how we can educate them about their health, the community's health issue of environmental sustainability and pollution, and kind of meld all those issues together. And this will be something we'll be working on throughout the next year. There's a task force of, I think, about 10 or 12 people. I may be off on the number, and we'll be meeting for the first time in January. And the first step will be gathering information on, as I said, the tools that our landscapers use. We have surveys out in English and Spanish. And what all of you can do, actually, and is Sustainable Princeton has a survey out there. As I said, it's available in English and Spanish. If you use a landscaper, or if your neighbors use landscapers, and we could get them to fill out this form to gather more information, that would be incredibly helpful. So you can email info@sustainableprinceton.org, and they will send you the survey, and you can pass that out, as I said, to your landscaper, to the landscaper of anyone, any of your neighbors, because the first step is to gather information. It really is a matter of, I mean, what you, the illustration that was just given of, leaves being blown around from one place to another. I think the issue is people perceive that that's doing their job. And I think demand from consumers is going to be one of the things that's going to change. Like, we recently, a couple of years ago, switched to a landscaper who mulches the leaves into the lawn. There's also been a Leave the Leaves campaign. And I look up and down my street, and everyone else has pile of leaves, and we have no piles of leaves because we're using the leaves on our lawn. It benefits the lawn. It's environmentally sustainable. We don't use leaf blowers. So there's all kinds of benefits that come out of that. But as long as the demand is for these pristine lawns with not a single leaf, it's going to be very hard for landscapers to not adhere to that. So some of it, this is a demand side issue, and some of it is a supply side. So, but what we hope to do over the course of the year is work with landscapers, educate them on alternative methods, find out what the obstacles are for them moving away from the gas-powered leaf blowers, and gathering data to influence the introduction of an ordinance that may either restrict the hours of leaf blowers, or require people to move on to different methods. But there's it's not going to be an immediate ban on leaf blowers, which I think disappoints some. But I think, again, it's so crucial. These landscaping businesses are often very small, and the demand to cease doing things the way that you've been doing them for a long time, to buy new equipment at this time, is just something that I think many of us feel very uncomfortable with. So we're looking at something that will both promote environmental sustainability and racial justice and equity. And a lot of groups are coming together to work on that together. So there is hope. and continue to stay involved and follow what's going on through this grant and through Sustainable Princeton, the Environmental Commission as well. That was a little long-winded. I apologize.
Okay, thank you. So just to summarize, I would say that there is a group, Quiet Princeton, that's doing some advocacy on this. There's also, you can reach out to Sustainable Princeton and also go on the municipal website, princetonnj.gov, and attend the Environmental Commission meetings where this ordinance and policy will be getting worked on and developed. So thank you for your comments and for asking how to get involved. Is there anybody else who'd like to make a comment as part of public comment? You can, if you want to make a comment, you'll need to raise your virtual hand so I can see you. Okay, seeing no one, I'm going to close public comment and we'll move on to the next agenda item,
Mayor
which
Lem-
is,
Mayor Lem-
yeah,
I just wanted to make a comment about that, which is I know that people in the community feel very frustrated about this, and I don't want them to feel like the process that Sustainable Princeton and the Environmental Commission are embarking on will be an endless one with no end date. I do think there will be an ordinance. I support an ordinance, as do I think most members of council, but to the point of the previous discussion that we had about viewing our policies and programs through a racial equity lens, this is an example of where we are taking into account really very important racial and socioeconomic issues that are need to be, it would be irresponsible for us to consider this issue without taking those issues into account and without seeing this through that lens. But that doesn't mean, after looking to figure out ways to balance out some of the the inequities that could occur if we rushed into a quick solution. Once I do believe that we will move towards an ordinance, and I just want to reiterate that we are not insensitive to the tremendous disruption of quality of life that this causes for residents, many residents in Princeton on a daily basis. And this is a solution that is being done the right way, but it will not be an indefinite process. So just want to reassure people of that.
thank you. And in the meantime, it looks like we have two additional comments. So first is Phyllis Teitelbaum.
I've unmuted. Can you hear me?
We can, yes.
Good. A colleague named Yevgeny Nijinsky told me that he sent a comment to the Princeton Comments Gmail address. Did you receive that, Mayor Lempert?
I'm going to check right now. I don't think so, but it's possible that I missed it. Hold on. Yes, I did. Thank you. I'm going to read it right now. This is from Yevgeny Lawrence Grishta Gabriel, 27 Mason Drive. Dear Mayor and Council members, my wife and I and our children all urge you to make banning gas-powered leaf blowers a priority goal for 2021. Gas-powered leaf blowers are a significant source of air and noise pollution. Their negative externalities are so numerous and obvious, they are not worth repeating again. Instead, let us all envision Princeton after they are banned. It will be Princeton where our children will be able to focus and learn in a quiet environment, where thousands of adults working from home 1, 2, or even 5 days a week are more productive, do not need to take conference calls from their cars, and can actually hear themselves think from the comfort of their own homes, where families will be able to enjoy their porches and backyards and listen to bird songs and the quiet sounds of our beautiful neighborhoods, And most importantly, where workers who operate these noisy, polluting machines will not be destroying their lungs or going deaf. This is as much of a physical and mental health issue as an equity issue. With negatives and positives being so obvious, the question before you is not when is the right time to do something, but why have you not done it already? Dear elected representatives, there are many problems at the global, national, and state levels that you have no power to do anything about. This very local issue you can make right, and for the health and wellness of all Princetonians, you must. Thank you. Okay, so again, I wanted to ask if there are any other comments as part of public comment, and seeing no one. Yes, D. Kiefer, or yeah.
Yes, hi, can you hear me?
Yeah.
Hey, this is Darwin Kiefer. I'm a patrolman with
hi.
the Princeton Police Department.
Yeah.
Yeah, and actually the president of our PBA Local 130. I just wanted to check in with everybody. At last month's meeting with Chief Morgan, he did mention that we were going and joining up with the Human Services Department to adopt some families for the holiday gift drive. And I just wanted to let everybody know that you'll see us out and about in these next 2 weeks. We've actually, as a union, we've adopted 16 total children, 8 families. We're super excited for it. And this, the money that we're using to buy these presents comes directly from donations from the community towards our union, and also directly from our officers' pockets. So just wanted to let everybody know to keep an eye out for us. You'll see us in some of the neighborhoods. We'll be out there with the lights on, with a lot of holiday cheer. So we just want to let everybody know that in this holiday season and these crazy pandemic times, that our police department and our officers and our union are working hand in hand with the community to try to make Princeton just the best community in the state to live in. So just want to let everybody know. Thank you very much.
Thank you very much.
Great job. Great job.
Thank you. And I know that the Human Services, I don't know if Ms. Fraga is going to have a report about the toy drive when we get to reports, but I think it was incredibly successful this year, and they were able to take over the old Borough Council chamber room. And so just to see all the presents in one space is incredibly moving, and like a kid fantasy also to see that many presents. So it was a real outpouring from the community. So I'm glad that the PBA was such a big part of that. All right, and so seeing no comments, I'm going to close public comment and bring it back to our next item, which is our report from tonight, which is the October police report. And I'd like to welcome the chief, Chris Morgan.
Good evening, everyone. Good to see everyone. Hope everyone is well. That was a great comment by Bill. I mentioned it the last time, like he said, they put a lot of work into it and a lot of effort, and so proud of everyone in the department for what they've done. It's such a great accomplishment, and it's a great time to have it done with everything that's going on right now. So I think they're going to be able to help out a lot of people, which is great to hear. Looking at our October police report, quite frankly, you'll see a lot of similarities to what you've seen in some of our most recent reports. A lot of the data that we collect and that we've been reporting on is lower than what you would see, if I dare say, in a normal year, non-pandemic type year. But we've talked about that a few times now, with everything being down because of the pandemic. When you look at the calls for service, there was a slight increase compared to last month, but last month was particularly a low mark for calls for service. So there was a slight bump there. In regards to traffic, we continue to address some of the more egregious type violations with motor vehicle stops. We continue to use our decoy cars, the variable message boards, and our radar signs. And actually, the community has been great. We've received a few comments from residents acknowledging the decoy cars, saying that they are productive, that they have been helpful in their neighborhoods. And and some have even offered up some of their private driveways as a place to be able to use them. So we're very much appreciative of that. You will notice that there was a slight increase as well with the overtime for patrol. That's because we had some officers that were exposed to the virus, and obviously had to be quarantined for a significant amount of time, which then obviously created some overtime issues. It's worth pointing out that none of those exposures did take place at work, though. They are provided with the PPE, the masks that are required to wear them outside anytime they're in contact with people. So a lot of the exposures, quite frankly, were taking place because maybe like young children or other family members were coming home from work or school, and there was some cross exposure there, but nothing at work. Outside of the report, just a few items that's worth bringing to your attention. Our recruitment process remains very strong. We are incredibly pleased with where we are right now. We're at about 260, 270 applicants already, which is fantastic. And we had really two goals going into this process that we wanted to achieve. We wanted it to be a very diverse applicant pool, and we wanted to bring people from the Princeton community into our applicant pool as well, or at least with certain ties to the community. Going through some of the applications and resumes that we've reviewed so far, we're very successful in achieving both of those goals. So again, it's moving very well. It's moving in the right direction, and probably we're looking at the beginning of next year to start the next phase of conducting interviews. We've gone through some of the numbers where we're at 51 officers right now. We have 4 officers that are able to retire this year, another 2 that are eligible for next year. And depending on the applicant that you hire, it could take anywhere from almost 6 months to an entire year before they're able to be fully certified and count as a full-time member of the police department. It's been mentioned a few times already, the topic of the vaccine, but just from a police perspective, we've worked very closely with the COVID status group and Mr. Grosser with just receiving information from the health department that he's provided us and links to the CDC, and we've been sharing that information with our staff as well. So when the vaccine does become available to first responders in Princeton, that our staff has as much information as we can provide them so that they can make an informed and educated decision about taking the vaccine. And just why I mentioned Jeff, and I mentioned it last time, but it's worth singing his praises again. He's been absolutely fantastic, a great supporter of the police department. He's given us a lot of information and a lot of direction that's been incredibly helpful. And we're trying to now support him on the distribution of the vaccine. But my hat's off to Jeff, and it's worth mentioning again how fantastic he's been through this time in Princeton with the pandemic. A bit of a public service announcement. We haven't seen a lot, but we have seen a couple of packages that the holiday season and packages being delivered to people's homes and left on the front porch. We've had a few stolen from the front porch. We put out some social media information on how to better protect yourself, but ideally, if you can, if you're expecting a package, communicate with a trusted neighbor and kind of look out for each other. Maybe take the package off the porch if you can, and then retrieve it when you get home. Again, not that we've had many. I think I've seen 3 so far during this holiday season. But worth mentioning. And then something else that someone in the community brought to our attention, and I said that I would share it tonight as well, that if you are, for the holiday season, you're going to leave a gift or give a gratuity perhaps to maybe a delivery carrier or a sanitation worker, that maybe you don't leave it out overnight or throughout the day. Maybe if you're able to, if you see them coming down the street, then you can walk it out to them.
Thanks, Chief. Ms. Niedergang?
Thank you, Chief. I do have one question, a kind of a question that's a product of an omission in the report. I've heard anecdotally, or I guess it's not anecdotally, but I've read that reports of intimate partner abuse, domestic violence are pretty significantly down nationally. And I've noticed that a little bit in our local statistics. And I don't really know actually if this is a police matter even, but I wonder, I'm sure you're thinking about people that under other circumstances might call the police, who are now essentially trapped in a house and apartment with their abuser. Is this something that you were talking about, thinking about working with other community partners on to kind of be proactive about? And again, I'm not even sure it's 100% a police question.
Yeah, it's difficult, to be honest. A lot of those situations we need to get called to. It's more reactive, unfortunately, for us. We don't always obviously know what's going on in people's homes, but the officers are trained every year, 4 hours of domestic violence training every year. And part of that training is to find signs where maybe someone who is being abused, but they're not coming out with the information right away. Different ways to be able to draw that information out. And then we've been in contact with Human Services, with some just local areas and different resources in the area that we can send people to, or at least notify them of.
Okay, thank you.
Sure.
Thanks. Are there any other questions from council? Okay. All right. Well, thank you for the report this month. Yeah, thanks. Happy holidays.
Yeah, great holiday, Chief.
Happy holidays. Thank you.
Thank you.
Okay. So now we come to resolutions, and I'm actually going to be recusing myself for this first resolution.
Mayor, do we want to do council reports?
Yeah.
Oh, yeah, I always forget that. And I even wrote it down and then I forgot. Thank you. Yes. We'll start with Council President Cohen.
Okay, thank you. I just have one report for the Permanent Parking Task Force, and I made a small part of it up during announcements where I mentioned the meeting in the Witherspoon Jackson neighborhood on January 12th. That's a Tuesday evening. Can look for more information about that on the municipal website as we get closer to on the calendar as we get closer to the date. But I did want to give a little bit of information about what we've been up to. We've met in recent weeks with members of the Bank Street and Tree Streets neighborhoods and received valuable and constructive feedback on the draft of the proposed pilot for the new resident and employee permit parking system. We're continuing to wrestle with the specifics of overnight parking restrictions, and we're delving more deeply into integrating the available technology for license plate recognition, enforcement, for e-permitting, which will facilitate online application for permits without requiring visits to the municipal building, and e-ticketing, which will reduce errors and create more efficient enforcement. We're planning okay, and then yeah, so after the meeting in Witherspoon Jackson in early January, we expect to bring a resolution with a final recommendation for what the pilot will be at some point later in January. And just to let you know, with the technology that we're looking to use, it will probably take a couple months to get from that resolution to an actual rollout of the program itself. So we don't have an exact date in mind, but probably around the beginning of April.
And may I add, because the question did come up, we recognize that it's the end of the year wherein our residents would be applying for their permits for next year, that we discussed the possibility, and I don't know if this would be the place because it is coming up, of recommending perhaps a moratorium until the pilot is in place, a moratorium on the individuals who actually are paying for their permits in the neighborhoods where we're going to be implementing a pilot program.
I would say that we should take this offline, and that you need to, I think the clerk's office has already been selling permits.
Okay.
So I would take it, I think this is like a different tack than had been discussed last week. So
I just wanted to add that they had come up because we did take that into consideration.
Okay.
That's all I have.
Okay, thank you. Councilman Fraga?
Yes, and I wanted to follow up on regarding the Human Services holiday gift drive. The distribution began today and is going to continue throughout the week. Human Services was able to set up a contactless pickup for the recipients and included home deliveries for families who are in quarantine. Their gifts are being delivered to their homes. In addition to the children's gifts, each family is going to be receiving a gift card from McCaffrey's, ShopRite, Target, Terramomo, Just Sam's, or D'Angelo's. They're going to get to choose which one. The drive ended up with 333 children who were able to be covered by this drive with the help of 180 donors. And in addition to the thanking the PBA Local 130, who mentioned already they've been involved in this. Human Services also wishes to thank Stonehill Church, Dorotea's House, 10 Acre Foundation, Princeton Children's Fund, Weicker Realtors, Church and Dwight, the Princeton Rec Department, and the Woodland Drive neighborhood, and wanted to mention that Church and Dwight donated toothpaste and toothbrushes to be included in the gifts. So I know probably Human Services will have a more extensive list that they usually issue a letter, do a letter to the editor to thank the donors, but just wanted to mention that's ongoing right now. And yeah, thank you to everyone who participated.
That's great. Thank you. Councilman Williamson, any reports?
None, Mayor.
Okay. And Councilwoman Niedergang.
I already did mine on the leaf blowers.
Leaf blower. Perfect. Okay. And Councilwoman Sachs, any reports?
No, thank you, Mayor.
And how about Councilwoman Pro-Lambros?
No, actually, but I just have one thing that I just remembered that should be an announcement, but I'll just mention it now. The Mr. Rogers Neighborhood gift basket that Blair Miller is running has opened their store on 14 South Tulane Street. It's a wonderful program, so I just wanted to mention that. It supports the the local community, and it also supports the merchants. So it's terrific if you can stop by.
Terrific. Thank you very much. I think the hours there are Friday through Sunday, but people can check. I think they have a Facebook page if you're interested in going there. Great. Are there any additional staff reports?
Yes, Mayor, just one. I just wanted to report that today Public Works reorganized the outdoor dining space on Witherspoon Street. Some of the bin blocks were removed on both Witherspoon Street, Pine Street, and Whole Fish. Parking spaces are being reestablished where it is safe to do so. We'll continue to monitor the activity downtown and work with the businesses to see if modifications will be necessary as the winter progresses.
Thank you. And I do want to give a shout out to both Deanna and the engineering department and Public Works for the quick action on this. I think that we've been really lucky with the weather up until now, and even this past weekend was gorgeous. And we wanted to be able to extend the outdoor dining season as long as possible and be sort of flexible with the dates. And then of course you have a beautiful weekend, and then a prediction of 12 inches of snow. So appreciate everyone's quick response to that. Okay, are there any other reports? And if not, then I'm going to go back to what I said earlier prematurely. We're now at resolutions, and I'm going to recuse myself from this first resolution because it concerns the voluntary payment with Princeton University. And since my husband is a professor there, just so that there's no appearance of any conflict, I'm going to be recusing myself and turning the meeting over to Council President Cohen.
Thank you, Mayor. So the first resolution for tonight is number 20-384. It's a resolution approving a new voluntary contribution agreement between the municipality of Princeton and the trustees of Princeton University, effective through December 31st, 2022. And I'm going to call on Councilwoman Niedergang, who has been one of the members of the negotiating team working with the university to talk a little bit about the agreement. Ms. Niedergang.
Thank you, Council President Cohen. I just have a brief statement that I'll read before I will turn this over to Councilwoman Perrin-Lambros, who we work together with the university on this agreement, which we're very happy about. The resolution on tonight's agenda is the result of our year-long discussion with Princeton University to affirm the university's commitment to the well-being of the municipality and its taxpayers. The agreement continues the pattern of 4% increases of the voluntary payment in each year for the next 2 years, and also carries over a previously agreed upon commitment of $250,000 for the municipality's planned cold storage facility to be built at River Road. The university has also made additional contributions to the municipality's newly instituted career firefighter program, which my colleague Councilwoman Perrin-Lambros will discuss in a moment. Council believes that this short-term agreement is one key step in continuing to build a relationship with the university focused on our mutual shared interests in maintaining the town's fiscal health, diversity of population, and thriving downtown. And I just want to take a moment also to acknowledge the tremendous contributions the university has made to the British Resiliency Fund, to the other fundraising efforts to help people during the course of the pandemic. They've really been a tremendous partner, and it's really appreciated. So, Councilwoman Perrin-Lambros, floor is yours.
Thank you, Councilwoman Niedergang, and thank you for your
Any questions from members of council for the negotiating team? Okay. In that case, I'm going to open it up and see if anybody from the public would like to comment or ask questions. I am not seeing any questions. So I will close public comment and ask if anyone would like to make a motion.
So moved.
Okay, moved by Councilman Williamson, seconded by Councilwoman Sachs. All in favor?
Aye.
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 Any opposed? Great. The resolution is carried unanimously, approved unanimously, and I will turn the meeting back over to Mayor Lempert.
Good job, David.
Thank you.
Even without a gavel.
I'm very proud.
Very smooth.
We're proud of you too.
Next is Resolution 2385, resolution authorizing the purchase of an easement cleaning machine for the maintenance of sewers and easements at a not to exceed cost of $79,614.30 using Sourcewell contract number 122017-SCA. And I see Ms. Stockton has appeared. And also Andrew Philippi is here. If there are any questions from council on this resolution, it seems like I think we've all read it and understand the crucial need for it, especially if we don't have it.
We really wanted to be able to go through and explain the easement machine to you.
Well, it did actually look pretty cool. And I thought the map was actually really fascinating that, so many of the easements go on private property and are sort of hard to get to. So, yeah, I think that if anybody's super interested, given the time, I would recommend that they look at the packet materials attached to tonight's agenda. And I wanted to ask council if there are any questions on this, and if not, if there's a motion to approve. Moved by Ms. Niedergang and seconded by Ms. Perrin-Lambros. All in favor?
Aye.
Any opposed? I would say that if it's not too disgusting, this might be one of those machines that that the public might be interested in seeing in action. So it's really easy now to take like a iPhone video. So once it's in the field, I have no idea what it looks like, and so use your judgment.
Mayor Lempert, I would like to point out that we were only earlier this evening called the cool kids, and you've just completely ruined it.
Well, you
And
never
I
know.
will,
It
I
could-
will
it could go
reiterate that it was
viral.
not us. It was not us, Eve, who were the cool kids.
Yeah, it could go viral on YouTube. You never know. Okay. So the resolution passes unanimously. Congratulations. Next is
Thank you.
Thank you.
2386. Yeah, thanks. Resolution authorizing professional services agreement with Whitman Environmental Consulting. I see Mr. DeShield is here. Are there any questions on this resolution?
I have
Ms. Brown-Lambros?
just have one question. Do we have a update on insurance, on the insurance claim that's going to help to pay for defray some of these costs?
Yes, as council is aware, we have had some difficulties with the insurance carrier in covering the claim. Our environmental attorney has been in contact with the insurance carrier's attorney. They have given a final date for them to make a decision is the 18th. Once this resolution is passed, we will hold any execution of that resolution until after the 18th. It'll give them an opportunity to take on the coverage or not. If they do not take on the coverage, we will take actions against the insurance carrier for not covering us for a legitimate claim.
Okay. All right. Thank you.
Are there any other questions on this resolution? Is there a motion to approve? Moved by Mr. Cohen, seconded by Ms. Brown-Lambros. All in favor?
Aye.
Any opposed? Resolution passes unanimously. And next is 2387, resolution awarding agreement for extraordinary and specifiable service to Sustainable Princeton in the amount not to exceed $90,000. And are there any questions on this resolution? Ms. Brown-Lambros?
Just a comment to say that the Sustainable Princeton team just does a wonderful job, and I just like to commend what they do for us. So I'm just in favor of that. Just wanted to say that. Thank you.
Great, thank you. If there's no other questions or comments, is there a motion to approve? Moved by Ms. Niedergang, seconded by Ms. Brown-Lambros. All in favor?
Aye.
Any opposed? Resolution passes unanimously, and I think we all agree with Ms. Brown-Lambros's comments. We're really fortunate to have Sustainable Princeton as partners, and they've just been instrumental in creating the climate action plan and really taking us through the implementation of it. So it's hard to imagine that happening in the same way expeditiously without them. So thank you. All right, next is 2388, resolution authorizing the solicitation of sealed bids as a concession for community Wi-Fi project. And this is part of what we started our meeting on with the community development block grant money. So this is another one of the big projects, which is providing Wi-Fi to several of the affordable housing developments in town. And this is to allow for the bidding process to move forward on that. So I don't know if there's any questions or if there's a motion to approve.
So moved.
So moved.
Moved by Mr. Williamson, seconded by Mr. Cohen. All in favor?
Aye.
Aye.
Any opposed? Okay, resolution passes unanimously. Next, we come to the consent agenda, which contains items of a routine nature passed by single vote. I know there was a question about the Green Acres resolution, so let's pull that one. Ms. Stockton?
We also pulled number 20 on that agenda, on the consent agenda for Iron Tile and 120 Wynant.
Okay.
That wasn't ready. It'll be on the December 21st agenda.
Okay.
Thank
Are there
you.
any other items? Sure. Anybody else wants removed from the consent agenda? Okay, so is there a motion to approve the consent agenda items 1 and then 3 through 19?
So moved.
Moved by Mr. Cohen, seconded by Ms. Niedergang. All in favor?
Aye.
Aye.
Okay, the consent agenda items 1 and 3 through 19 passes unanimously. And next, let's take up 2390, which is the resolution authorizing grant agreement Green Acres program for open space acquisition. And I'd just like Mr. DeShield to explain what this is what this money is going towards, and the background on this.
Thank you, Mayor. This is our grant award. We made an application some years ago for additional funds for the Green Acres Grant. The one thing that's different about the Green Acres Grant, it's called a Green Acres Planning Grant, which means when you make the application, it is not necessarily specifying a specific property of the purchase. We do identify properties for potential purchase. When we made the application, we did identify properties. This grant award is for $125,000 of Green Acres funds, which we have to have a 50% match. This will be for any acquisition of open space that we chose to purchase. So there is not necessarily a specific spot that we have identified for this purchase, but it is additional money that is available to us to allow for. The one thing I also wanted to explain, we had a previous balance in that account, which means we have a total of $500,500 in funds available for to be expended in the Green Acres program.
Are there any other questions about this? Is there a motion to approve the resolution? Moved by Ms. Niedergang, seconded by Ms. Sachs. All in favor?
Aye.
Any opposed? Okay, the resolution passes unanimously. And is there a motion to adjourn?
So moved.
Moved by Mr. Cohen, seconded by Ms.
Second.
Niedergang. All in favor?
Aye.
Aye.
All right, meeting is adjourned. Thank you, everybody, and good night.
Good evening.